Tracking imaging-specific quality improvement work across a large, integrated, multi-facility healthcare system. mHealth Fairview is a nonprofit health system comprised of multiple hospitals, clinics, and other entities with imaging services provided at numerous locations. Given the size and scope of our organization, there was a need to identify, track, and share the widespread work being done relevant to quality, safety, and compliance. While the program was under development at our university practice, we were soon headed toward integration with a larger healthcare system. Considering the size of that integration, with over 1 million imaging exams annually, the scope of our work was expected to expand dramatically. We needed a means to track and monitor the quality and safety work being done across the system. Our aim was to create an infrastructure consisting of operational and clinical leadership to oversee the quality, safety, and compliance of imaging services, as well as provide a forum for tracking, monitoring, and sharing improvement activities. As part of the framework for this program, a lead committee was created and began meeting regularly on a monthly basis following the system integration. 30 minutes of each monthly committee meeting was dedicated to an improvement showcase. This showcase was structured to, among other things, invite discussion and promote sharing. The work reported over one cycle of the improvement showcase was categorized by type of work and organized by site. There was a total of 75 different improvement projects reported among all sites as shown here. Almost all sites reported work related to quality and safety, customer experience, and people engagement, while fewer sites reported work related to efficiency and research and education. During the reporting timeframe, we observed a decrease in projects related to efficiency. Although there was a short-term increase in improvement projects related to quality and safety, this diminished toward the end of the reporting period, and a similar trend was observed for projects related to customer experience. It is not surprising that the only 2 sites reporting improvement work focused on research and education were also the only 2 sites staffed regularly by physicians with academic appointments and trainees. While a large number of projects focused on quality and safety was expected, the decrease in the number of these projects over time was not anticipated. Of course, it is important to consider these observations in the context of the pandemic. Although one might have anticipated an increase in projects over time due to new initiatives and changing infrastructure, this trend was not observed. Reductions in staff and diminished on-site presence likely limited the ability to begin new projects. It is also likely that some projects were not reported during the showcase, although they were occurring. Furthermore, time constraints may have limited the ability to report all projects. This categorization of work is imperfect, as some work may impact more than one category. So while some conclusions might be reached from this categorization, this process will need to continue to more confidently identify trends. In summary, tracking imaging improvement work across a large healthcare system can be achieved by implementing a regularly scheduled forum with time dedicated to sharing the work. Ultimately, observing trends in the work is complex, but can be accomplished, although it remains challenging to interpret. Thank you for taking the time to learn more about our project.